You know that jolt of panic every new pet owner feels? You see your brand new puppy or kitten suddenly limping, and you wonder, is this just growing pains, or is it something serious? Well, today we are pulling back the curtain on the critical bone diseases that can hide behind that limp. And believe me, understanding the difference can change everything.
I mean, it's a heart-stopping moment, right? You see your little buddy suddenly favoring a leg, and your mind just starts racing. Is it a sprain? Did they just play a little too hard, or could it be something more? That exact feeling of uncertainty is what we're going to clear up right here, right now.
All right, so here's our roadmap. First, we'll talk about why just calling it growing pains can be a risky move. Then we'll dive into the big problems that hit large puppies and see how your pet's breed can be a massive clue. We're going to give cats their own spotlight too. Then we'll uncover a truly tricky disease before we pull it all together from a vet's point of view. Let's get into it.
Okay, first things first, let's just bust a huge myth. While, yeah, a little bit of soreness can happen when a pet is growing, real consistent limping is almost never just growing pains. It's your pet's only way of telling you that something specific is wrong. Ignoring it could mean missing a really important window for treatment.
Now, let's zoom in on those rapidly growing gentle giants. You know, your Great Danes, your Goldens, your German Shepherds. If you've got one, there are two names you absolutely need to know. Hypertrophic osteodystrophy, we'll just call it HOD, and panostitis. They can look super similar, both causing that worrying limp, but as you're about to see, they are worlds apart.
And this slide right here nails the single most important difference. Both cause lameness, sure, but they happen in totally different spots on the bone. HOD hits the metaphysis, that's the wider part right up against the growth plate. Panosteitis, on the other hand, goes for the diaphysis, which is the long main shaft of the bone. For a vet, knowing where it hurts is the key that unlocks the whole diagnosis.
So what does HOD actually look like in real life? Okay, picture a very young, large breed puppy, maybe just 2 to 6 months old. They're not just limping, they usually have a fever, they feel really crummy, and you can actually feel this warm, painful swelling right near their joints, like their wrist or ankle. That classic combo of signs is a huge flashing red light for HOD.
So, how do vets nail the diagnosis? This is where it gets really cool. On an X-ray, they're looking for this super specific sign, a dark line, that's what loosened means, running right alongside the growth plate. It's almost like a second ghost growth plate shows up. And that right there, that's the smoking gun for HOD.
Now for the other big one, panosteitis. This one usually shows up in slightly older pups, say between 5 and 12 months. And it is famous, for one really specific and kind of bizarre symptom, the shifting leg lameness. 1 week, they're limping on their left front leg, then a couple of weeks later, that one's totally fine, but now their back right leg is sore. That migrating pain is classic panosteitis.
Diagnosing this one with an X-ray can be a bit of a challenge. Instead of a clear, dark line like an HOD, vets are looking for these subtle, fuzzy white patches. That's the increased opacity, deep inside the bone shaft. But here's the catch. Especially early on, the X-rays can look completely normal, even when the dog is in a ton of pain. It's a real puzzle for sure.
Okay, so we've talked a lot about big dogs, but sometimes the biggest clue isn't the dog's size at all, it's their breed. So let's switch gears and look at a couple of conditions that are practically hardwired into the DNA of certain terriers and other small breeds.
First up is craniomandibular osteopathy, or CMO. Yeah, it's a mouthful, I know, but the name tells you exactly what it is. Cranio for skull, mandibular for jaw. It's this painful disease where extra bone actually starts growing on the skull and jaw, and it almost exclusively picks on young terriers like Westies, Scotties, and Cairns.
This is one of those rules in veterinary medicine that is just golden. I mean it. If a young terrier walks into the clinic and it hurts them to open their mouth, they're drooling, and they don't want to eat, CMFO immediately jumps to the very top of the list of possibilities. It's an incredibly powerful clue.
And here's another one that targets the little guys, but this time it's all about the hip. With Legg-Calvé-Perthes disease, the ball part of the hip's ball and socket joint tragically loses its blood supply. And without that blood flow, the bone just starts to die and crumble away. It's a really devastating condition you see almost exclusively in small and toy breeds, like your Yorkies and miniature poodles.
All right, we've been talking a lot about dogs, but what about our feline friends? Cats have their own totally unique set of bone problems, and they can be way more subtle about it. So let's turn our attention to the specific orthopedic challenges that can affect kittens and young cats.
Now this condition, slipped capital femoral epiphyses, or SCFE, it has a very, very specific victim profile. The classic patient is a young, neutered male cat who's also carrying a little extra weight. In these cats, the ball of the femur can actually slip right off the neck of the bone, right there at the growth plate. That combination of risk factors is a huge warning sign for this painful hip injury.
Now this is one of the most unusual and frankly fascinating conditions in all of veterinary medicine, feline lung digit syndrome. It's when a primary cancer in the lungs spreads or metastasizes not to the liver or lymph nodes, but specifically to the tiny bones in the toes. The cat shows up with a swollen, painful toe, but the real problem, the root cause, is all the way up in its chest.
And that leads to this absolutely critical diagnostic rule. Because of lung digit syndrome, any older cat that comes in with swelling in one or more toes is immediately going to get chest x-rays. That just has to rule out the possibility that the toe problem is actually a sign of a very serious hidden lung tumor. Speaking of problems that aren't what they seem, let's talk about one of the great imposters. It's called hypertrophic osteopathy, or HO. It shows up as severe, painful swelling in the limbs, but that's all just a smokescreen for a much more serious problem happening somewhere else entirely.
Just think about that for a second. An animal comes in with painfully swollen lower limbs. It looks for all the world like a primary bone problem. But what if the cause wasn't in the legs at all? What if the real disease was happening deep inside the chest cavity?
So here's how this totally bizarre chain reaction works. It all starts with something in the chest, usually a big tumor or a bad infection. For reasons we are still trying to figure out, this triggers a weird reflex that sends a massive flood of blood down to the limbs. The body's tissues get all confused, and the thin layer covering the bones, it's called the periosteum, just starts rapidly laying down layers of new painful bone. So the leg pain is very, very real, but it's just a symptom of the disease in the chest.
Phew! So we've gone through a whole bunch of different conditions, and each one has its own set of clues, right? Now let's pull it all together. Let's see how a vet basically becomes a detective, using age, breed, and symptoms to solve the puzzle of a limping pet. This table right here, this is the ultimate cheat sheet. It lays everything out, side by side. Look how clear the patterns are when you see them like this. A large puppy with a fever? Bam! You're thinking HOD and looking for that lucent line on the x-ray. A young terrier with jaw pain? You gotta think CMO. An overweight, neutered cat with hip pain? Your brain should go straight to SCFE. Each disease really does have its own unique signature.
So, if you only take away a few things from all this, let it be these connections. HOD is a metaphysis problem in big puppies. Panostitis is that classic shifting lameness. CMO belongs to the terrier's jaws. LCPD is for small dog hips. SCFE is for those chunky, neutered male cats. And don't forget, both hypertrophic osteopathy and lung digit syndrome are limb problems that point you straight to the chest.
You know, at the end of the day, being informed is your single greatest tool as a pet owner. Understanding the specific risks that come with your pet's breed, their age, and their size, it turns you into their #1 health advocate. So the next time you see a limp, you'll know it's not just a growing pain, it's a clue. The only question left is, what are you going to do with that knowledge?